Cancer cases in Kenya have been on an upward trend, with an estimated 47,887 cases recorded annually, with about 32,987 deaths each year. Lung and stomach cancer are among the 5 most common cancers for both men and women in both industrialized and developing countries. World Health Organization estimates that these figures will only worsen in the next 20 years, increasing to 10 million deaths and 15 million new cases annually. Tragically, lung cancer alone is the second most common cancer and is also known as the leading cause of cancer deaths in men and women worldwide. Compared to stomach cancer, which is declining worldwide, lung cancer is the deadliest of all cancers for both men and women. Now, this November, being Stomach and Lung Cancer Awareness Month, we'll be cultivating a better understanding of these diseases. My name is Lane Kanombogo and this is Frontline. Now on this week's episode, as we get a better understanding of lung and stomach cancers, we are joined by Dr. Catherine Nyongesa, an oncologist and CEO at Texas Cancer Center. Thank you for creating time, Dr. Catherine. Perhaps we could start with the basics. What is cancer?
So cancer is a disease that affects, now we are focusing on human beings, and it is an abnormal proliferation of cells. These are actually normal cells in the body, but they somehow mutate or become abnormal, and they start multiplying without ceasing. It's uncontrollable multiplication. And with this excessive multiplication, they are hardly dying. They form a mass or a growth inside the tissue where it started. If it is in the blood, then they'll spill over the bloodstream. It is called blood cancer or leukemia. But if it's in the tissues, then it becomes a tumor or a growth, which is really cancer because it has the ability to spread.
Dr. Nyongesa, there are different types of cancers, but we'll pay attention to stomach and lung cancer since November is Lung and Stomach Cancer Awareness Month. Dr. Catherine, more than 2.2 million people are diagnosed each year with lung cancer. What are the risk factors that contribute to lung cancer?
So I would say the biggest risk factor for lung cancer is use of tobacco, that is smoking. The others are like genetic, whereby you inherit some bad genes from your parents or your kin. Use of exposure to asbestos, some environmental pollutants, and others really it is unknown. Yeah.
Smoking tobacco is just one of the drugs that people use, but there are other people who smoke shisha. In first world nations, you'll find that marijuana is legal and they smoke marijuana. Do they also fall under this category?
Okay, the thing is, when shisha is also it's tobacco really, so it's they call it electronic cigarettes.
Yes, electronic.
So
cigarettes.
it is tobacco. So it will at one point in time cause cancer. People who generally are also using this substance of abuse, they also socialize a lot. With people who are smoking around them, drinking. You know, it's a drug. So all those factors may contribute. Even if you are not an active smoker, you could also be a passive smoker. And we're seeing a lot of lung cancer in women. When you ask them, do you smoke? They say, no, I've never smoked. But does your spouse smoke? They say, yes, he's been smoking. Or have your parents ever smoked? Maybe the friends you hang around with, if they smoke, you are actually a secondary or second-hand smoker. So you are still at risk like any person who is actively smoking.
What if you're not a primary or secondary smoker? Can you still?
Yes, a small percentage of lung cancer occurs in people who have never been exposed to smoking. So it does occur. We're still trying to research to find the causes for that population. But majority, if you really dig deeper, there is some passive smoking. And all of us, you know, when in life, we've had fun, we've socialized with people and they've been smoking around us. So there's that small risk, but when you get more and more repeated exposures, the risk is higher. And as I mentioned earlier, the others could be unknown factors, use of asbestos, exposure to asbestos, radiation, yeah.
There are other people, for instance, Dr. Catherine, lung cancer strikes 900,000 men annually and about 330,000 women. What are the symptoms to look out for?
So we've seen that actually lung cancer is common in men. So I suppose also being a man, it's a risk for lung cancer. As men grow older, the chances of getting this lung cancer increases.
Even when they don't smoke,
yeah, just by virtue of age. So the symptoms of lung cancer in early stages, there may be none. But sometimes they mimic infections like pneumonia, flu-like symptoms. Patients will present with weight loss, a nagging cough that is not going away, or coughing out blood, chest pain. If it is left unattended, it can block the windpipe, so you present with difficulties in breathing. Sometimes water forms in the lung, and this water prevents the lung from breathing normally, from expanding and contracting during the breathing movement. So patients will have difficulties in breathing. Once this cancer spreads to other parts of the body, then you'll have symptoms related to where they have spread to. For example, if it goes to the liver, you'll have abdominal pain, jaundice, that is yellowness of the eyes. With bones, you'll have bone pain if it's gone to the bones. If it goes to the brain, you'll have dizziness, vomiting, headache, for example. And most people also who have been heavy smokers, when they come to hospital, you look at their fingers, they have what we call finger clubbing. There's swelling around the nail area, So those are just some of the symptoms. And obviously loss of weight, unexplained weight loss. If you've been treated for pneumonia or some chest, sometimes they tell you have chronic asthma. So if you're a smoker and the doctor is telling you have chronic asthma, chronic bronchitis, it will be good to be checked for cancer.
Unexplained weight loss,
yeah.
What's that?
So typically you are not over exercising, you do your routine, maybe exercise, but somehow your friends look at you like, okay, we suspect you are actually losing too much weight.
It's not intentional.
It's not intentional, yeah. Sometimes you're not even going to the gym because you feel tired most of the time when you're sick, but the weight is just going, which you cannot explain, you cannot pinpoint. For example, if you are exercising a lot, you will know definitely. Nowadays I go to the gym so many times, so it is intentional. But when this is not intentional, there's cause for alarm. And it doesn't just present with weight loss alone. There could be other symptoms. So it will be a combination of symptoms, like you'll be having coughing, chest pain, some phlegm, that's coming up your throat all the time. And you may have even coughing blood, and just excessive cough. That it's this cough, you get medication for it, 2-3 weeks down the line, it is still bothering you.
Dr. Catherine, there are men who are watching you right now and they actually want to quit smoking. One will say, I've been smoking for 1 year or 2 years, but since you've said that smoking will lead to lung cancer, I will quit smoking. After how long? Does the duration you were smoking really affect?
Yes, the duration that you've been smoking really affect, and even the quantities. So if you smoke 1 packet per day and you've been smoking for 5 years, and somebody who's been smoking maybe 2 sticks per day for the last 10 years, the risk is the same.
The risk is the same?
Yes, because of the quantity. The more cigarettes you smoke, it's a problem. The longer the duration you've been smoking for, it's a problem. And lung cancer does not happen like today you've been smoking and you get it today. The cigarette smoke, usually as you breathe in, it damages the lung tissue. This lung tissue tries to repair, and that's why most smokers, you'll find they have some lung issues, chest issues, the body tries to fight, but it reaches a point where that damage the body cannot handle, and those cells will, instead of repairing, they now go to multiply to become cancer. So if you are quitting, it is better you quit now. Don't wait for later, because any form of cigarette use or exposure, it's a health hazard. And you will not only get lung cancer, but the chances of you getting even throat cancer are very high, and esophageal cancer and other cancers. In fact, many cancers are associated with smoking.
Pollution, the environment. How important is the purity of the air we breathe?
We see lung cancer quite a lot in developed countries. So we know that industrialization with air pollution, if you don't manage it very well, will lead to lung cancer. But they are multifactorial. So we cannot just pinpoint to one factor, not just the environment, but research has shown that if there's asbestos, there's radon in the air, for example, it leads to lung cancer.
You've mentioned asbestos so many times, and I bet there are Kenyans out there who don't know what asbestos is. Can you please break it down?
Yeah, it is a cancer-causing chemical that has been found in it's naturally occurring, and people who get exposed to it more are the ones who work in the mines. It was noted some time ago that people who used to work in the mines came out with some problems with their chest, and when they did research, they found that actually it was asbestos poisoning or exposure which led to cancer.
Wow, we now take a short commercial break as we leave you with a short clip on the impact of COVID-19 on a tobacco user. Keep it sweet.
Evidence strongly indicates that smokers are up to 50% more likely to suffer worse from COVID-19 disease. That means that smokers are more likely to have worse symptoms, more likely to be hospitalized, more likely to be admitted into intensive care units, and require help with breathing and or ventilation. Ultimately, smokers are more likely to die from COVID-19 disease than someone who has never smoked. In general, we know that tobacco has many harms to people's health. That causes heart disease, diabetes, lung conditions like chronic lung disease, and cancers like lung cancer. And all these conditions, too, we now know, make people more vulnerable to COVID-19.
Welcome back. If you're just joining us, this is Frontline, and the conversation today revolves around lung cancer, lung and stomach cancers. To have this discussion, we are joined by Dr. Catherine Nyongesa, an oncologist and CEO at Texas Cancer Center. Dr. Catherine, continue. Yeah. Please explain to us the prognosis of lung cancer.
So it depends on the stage of the cancer when it's picked. The best prognosis is when we do prevention, whereby we know that most of it is related to tobacco smoking, so people should be encouraged to cease completely use of tobacco. But if you continue using, just know the risk that you are exposing yourself to. If it is stage 1, which means the cancer is just starting, it's a small growth in the lung, it's about maybe 2 centimeters, it hasn't gone much far, the prognosis is much better. As we move to stage 2, the growth is bigger, so more part of the lung is being affected. The worst stages are 3 and 4, where the cancer has, apart from affected the lung tissue, it has spread through some lymph nodes. And if it's stage 4, the cancer has spread to other parts of the body, like the lung, the liver, or the bones. So the prognosis is worse with advanced stages, and it's better. Actually, it's curable when it's stage 1 and 2. I would say the cure rate is higher by 80% in stage 1. But once you get to stage 4, the cure rate is very low, less than 10%.
Dr. Catherine, can lung cancer affect children?
No, because we say that majority are adults. So as you grow older, the chance of getting lung cancer is there. Children, when they get their lungs affected by cancer, it's mainly from spreading from other parts of the body. For example, they may be having what you call as bone or soft tissue cancer, sarcoma, spreading there, or kidney cancer spreading there. But rarely do we have primary lung cancer in children. So we simply call it secondary, whereby it is coming from another part of the body and the lung just becomes a secondary culprit.
I've heard of people saying that some cancers are genetic. Like if your family you have a history of prostate cancer, you might actually get prostate cancer. That's not the same with lung cancer.
No, it's true. There's some genetics that play a part in that, and also we suspect that there could be environmental factors whereby, you know, as a family, your brothers or your father, your uncle, somehow when you grow up, you are exposed to similar environment. So there could also be a possibility of you guys getting the lung cancer just because of there are some unidentified cancer-causing chemicals in your environment.
Apart from quitting smoking, how further can we stop this lung cancer?
If you have symptoms, because as we said, there are some lung cancers whereby smoking doesn't even apply. And there are people who've also been smoking for years and they don't have lung cancer. So we suspect there's more to it than just smoking. But smoking, we know, contributes to 80% of more than 80% of the cases. So what about this that we don't know the cause? So one has to have a high index of suspicion that when you're being treated for pneumonia, TB that is not going away, you are losing weight, you have some chest symptoms, it should be good for you to have either an X-ray or a CT scan of the chest for the doctor to assess your lungs. Because when it's caught early, the chances of cure are much higher.
Dr. Catherine, how often should one come for screening?
So we actually, for lung cancer, it's more of a targeted screening. So if you know you're in the high-risk group, you have a family history, you've been smoking heavily, it is recommended at least go annually for the checkup. For the rest of the population, you may have to go maybe once every 3 to 5 years for just an routine checkup. And at that time, most people nowadays, if you are even traveling, they will request for an X-ray of your chest. And that can actually help in picking up very early cancers.
You mentioned earlier about stage 1 and stage 2, and the prognosis might be easier than stage 4 or stage 3. Many Kenyans do not understand. They hear stage 1 cancer, stage 2, stage 3, stage 4. Can you please describe to us these stages?
So when we stage cancer, for lung cancer, for this instance, we look at we use what's called the TNM. T is the tumor size. So the smaller the tumor, the lower the stage. The bigger the tumor, the higher the stage. So tumors which are smaller, they will be maybe 2 centimeters, for example, that's like around stage 1. Then it goes to about 3 to 5 centimeters, that's stage 2, T2. Then bigger tumors, or they have invaded surrounding structures like the windpipe, we are already moving to stage 3. And if it has spread, then the stages is advanced. We also look at the nodes. So the lung drains to some lymph nodes. These are our gatekeepers for infection in the body. Mm-hmm. But when you have cancer, they also come in the forefront to fight. So they filter some of these cancer cells, and they get invaded by the cancer cells. So if you don't have nodes that have been affected, it's N0. If the nodes are affected, we move to N1 and N2 and so on. So the node. Then we look at metastasis. That is M staging. So with metastasis, when there are no metastasis, that means there's no spreading of the cancer to distant organs. It is called M0 or M0. If you have metastasis or spreading to other parts of the body, it's called M1. So we now utilize all the 3 things, the T size, the nodal size, and the M the metastasis, and then assign a group stage. So the group stage will be from stage 0, 1, 2, 3, and 4. So 0, 1, 2, 3, 0, 1, and 2, early stage, 3 and 4, late stage.
And your chances of getting cured in stage 3 or 4?
So it gets less and less. In Kenya, lung cancer is the 14th most common, but we think it's much more common than what is being reported, because patients are being treated for TB, chronic bronchitis, without knowing that they actually have cancer. And when they come, it's already in the late stage, and the chances of survival it's quite low. In the stage 3 and 4, it's less than 30%.
We can now maybe change gears to stomach cancer. The cases are declining, but that doesn't mean that they're not there. How does stomach cancer present itself, and what's the prognosis like, and what causes stomach cancer?
So most of the time, the cause of stomach cancer could be related to risk factors, which infections. There's a bacteria we call H. pylori. So if you get treated multiple times for H. pylori and the pains in your stomach are not going away, it will be good to be checked for stomach cancer. Another cause is use of tobacco, alcohol, diet that is low in fresh fruits. Excessive use of salt in your food is not good. And then when we look at the symptoms, most cases when it's early, there are no symptoms, unfortunately. But with the time, you have symptoms of acidity, you just feel bloating in the tummy, no appetite. You want to eat, but you just feel you are full, losing weight unintentionally. Just see your weight is going and you can't explain why. Pain in the stomach. If it's not attended, you'll have the tumor in the stomach starts bleeding. So this will manifest itself through the stool. You find your stool either they are dark because of all the blood that the tumor is bleeding. And with the time, you feel pain on swallowing food, belching a lot. If it spreads, then you'll have pain. It likes spreading to the liver, so you have pain in the upper tummy, swelling around the abdomen, jaundice, that is yellowness of the eye because of the liver being affected. It can also spread to the lungs, so you'll have coughing, chest pain, and those are the commonest areas, but literally it can even spread to bone, to brain, but rarely. Most of the time, by the time it spreads to the liver, the patients are already in hospital with those complaints.
Wow. Dr. Catherine, how fast does cancer spread, and what can hasten that process or slow down the process?
So there are multiple factors that help the cancer spread. One is the amount of cancer cells. So when you ignore these symptoms for too long, you've been treated for acidity for long and you are not getting better, then when they check there's a tumor, now the amount of cancer cells in the body will predict the chance of spreading. When it's in early stage 1 and 2, the chance of spreading is lower, but when it's stage 3 and 4, the chance of spreading is higher. The bigger the tumor, these cells are very loosely attached together, so they easily slough off and get into the bloodstream and spread or metastasize. Also, your immunity, when you are very weak, you are not able to fight cancer and it can spread quickly. Delayed or lack of access to timely diagnosis and treatment of cancer contributes. And obviously, if you've been misdiagnosed, so there's a lot of time lost when you've been misdiagnosed and being treated for other issues when it's actually stomach cancer.
Dr. Catherine, as we wind up, why do Kenyans rush to India? Does it mean that we're lacking something as a nation in terms of expertise or the medication or the machines?
In the past, in the recent, like 5 years ago, there's a lot of development that has happened in our country. We have cancer screening equipments down to the counties. We have multiple cancer chemotherapy centers also in our counties. These are public facilities set up by our government. We have national teaching and referral hospitals that are now even offering cancer care. In the past, we only had like one Kenyatta National Hospital, but now we have Moi Teaching, we have Kenyatta University Hospital, and soon other counties like we talk of Nakuru, Mombasa, Garissa. There's a lot that is actually happening. So people should not give up. There's positive developments. In the private sector, there's a lot of activity where patients can actually access treatment.
Like the Texas Cancer Center.
The Texas Cancer Center. So the thing is, 80% or more of the cancers that are ailing our community can be managed locally. A small percentage will need to go overseas for specialized treatment, and those ones we always allow patients to go. So one is free to seek treatment. Some of them, they actually don't want to listen to us, they go. And you know, when it's the biggest problem is that patients are presenting very late when the cancer is in very advanced stages and the prognosis is poor. So the message is hope and early diagnosis and timely treatment, because we have equally competent doctors locally. We have universities that are training doctors locally to manage cancer. So there's a lot in the horizon.
Thank you, Dr. Catherine.
Thank you.
Dr. Catherine is an oncologist and CEO at Texas Cancer Center.
Yes.
They say prevention is better than cure. Till next week, same time, right here in Frontline. Enjoy the rest of your viewing. My name is Lincoln Mbogo. Our producer has been Harriet Chime. Good evening.